Good day, everyone. I'm Sheila Ariel Silvestre, BSN 2-4. I'm going to demonstrate the hand hygiene and the PPE. The first procedure is hand hygiene. Gather the necessary supplies and stand in the front of sink. Do not allow your clothing to touch the sink during the washing procedure. Then remove the jewelry if possible and secure it in a safe place. Then turn on the water and adjust the force, but we will use the alcohol. Then wet the hand and there is area. Keep the hand lower than the elbow to allow water to flow toward to the fingers. Then use about one teaspoon of liquid soap form, dispenser or rinse bar or of soap lather thoroughly and cover the all areas of the hand then with soap product. Then rinse with the firm rubbing and circular motion. Then just do it. Just like this. Then wash the palm back of the hand, each finger between the finger and knuckles, wrist and forehand. Wash at least 1 inch above area of contamination if hands are not visible. Then just like this. Then continue this friction motion for at least 15 minutes. We're done. 15 seconds. Then use the fingernails of the opposite hand of your clean orange wood stick to clean the under fingernails. Then rinse thoroughly with water flowing toward fingertips. Then turn off the faucet with paper towel or tissue. As you can see, my hand is dry and pat hand dry beginning with the fingers, but no need. Okay, then use oil free lotion on hand if possible. Then next we will proceed to the donning and removing personal protective equipment or PPE, the gloves, gown, mask and eyewear. We have the purpose. The purpose, the patient and staff will remain free from the exposure to potentially infectious microorganisms. Then the gloves to protect the hand when likely handle any body substances such as blood, urine, feces, sputum, and non-intact skin. Then reduce the chance of transmitting microorganism from one client to another client. Then the gown worn by health workers during procedure when uniform likely to become soiled. Then the face mask to reduce the risk of transmission of organism by droplet contact and airborne drops and by flutters body substance. Then for the eyewear, goggles or face shield protect the mucous membrane of the eyes from body substance. Then we will proceed to the procedure assessment. Assess the situation to determine the necessary for PPE. In addition, check the patient chart for information about suspended or diagnosed infection or communicable disease. Then determine the possible of exposure to blood and body fluid and identify the necessary equipment to prevent exposure. Then we will proceed to the procedure. First, check the medical record and nursing care plan for type of precaution and review the precaution in infection control manual. Then always check the medication record or medical record. Then plan the plan the nursing activities before entering the patient room, as well as gathering all the equipment as follows: gloves, mask, the gown, and protective eyewear. Then provide the instruction about precaution to patient family members and the visitors. Then perform hand hygiene. As you can see, I'm done. Then we will proceed to the gowning. Pick up clean gown and allow to unfold front of you without allowing it to touch any areas soiled with body substance. Okay? Here, the gown, and to prevent the cross-contamination between the soil and clean areas. Then, slide the arm and hand through the sleeve, then fasten the ties at the neck, then to keep the gown in place. Just like this. Then overlap the gum back as much possible. Then fasten the waist. Then just like this. Ang gagawin po natin, kahit isang isang buhol lang siya. Isang ganyan. Para madali na lang siyang kukunin. Then, we're done of the gown. Then, you will proceed the wearing the face mask and eyewear. Then, locate the top of edges of mask, and mask usually had narrow strip along the edge. Then, hold the mask by the top of string or loop. We don't have the yung mask na ginagamit sa hospital, but I have 3D. Yan. Then, place the upper edge of the mask over just like this. Then, the bridge of the nose and the upper at least at the back of the head, or secure the loops around the ears. Then, if glasses, ayan, just like this. Then, if glasses are worn, fit the upper edge of the mask under the glasses. Then, glasses. For example, we have the glasses. Okay? Then, we will proceed the donning gloves. Open the package by grasping the edge of the cover. The gloves is open, ready to use. Then, using your non-dominant hand, dominant hand, grasp the opposite glove, and slide your non-dominant inside the glove, and leaving the cup pulled into just like this. Using then secured and opposite right after secured your fingers, then until it to properly place inside the gloves. And if wearing the gown, pull the gloves up to the cuff of the gown. Just like this. Iko-cover po natin siya dito sa gown para hindi siya makontaminate. Yan, make sure just like this. Then we're done to wear the all PPE. Then we will proceed to removing the all PPE. Then first, remove the PPE except for respirator. Remove the PPE at the doorway in anteroom. For example, we need to lumabas ng room without sa labas ng room ng pasyente. Okay? The proper removal prevent the contact with and spread of microorganisms. Removing respiration outside the patient room prevent the contact with airborne and microorganism. Okay? Then, if the protective gown has been tied in front of the body and waistline untied waist string before removing the gloves. And grabs the outside one glove with opposite of the glove. Okay? Then, slide the fingers and okay. Dapat po hindi natin matouch yung area na sa labas dahil yun po ay contaminated na. Yan, just like this. Then, we will ilalagay natin sa receptacle. Then, right after, slide the fingers of ungloved hand until the remaining glove at least, and taking care not to touch the outer surface of the gloves. Okay, then fear of the glove over the first glove and contamination the one gloves, discard it appropriate. Okay, just like this. Dapat po hindi natin matouch yung laob dahil using ginagamit natin yung contaminated. Just like this. Ayan. Isa clean. Then, yung loob ang ating kailangan i-touch dahil yun ang hindi contaminated. Just like this. And if merong dugo, ibuhol na natin para hindi siya matapon. Okay? Then, perform hand hygiene. Don't forget the WHO, yung 5, yung before touching the patient, before the procedure, before the touching the patient, after the procedure, and after the touching a patient, and after the after the touching a patient surrounding. Okay, then to remove the goggles or eyewear protective equipment handled by the headband or earpiece, light away from the face and place in designated place. Okay. Then to remove the gown, fasten ties it on the neck and back. Allow the gown fall away from the shoulder, touching only the inside of the gown. Pull away from the torso. Okay? Then, keeping the hand and inner surface of the gown and forearm. Then, to remove the face mask, grabs the neck ties or elastic the top of the elastic. Then take care to avoid the touching front of the mask and respiration. Discard into proper container or the proper waste container. Then contaminate just like this, because the front of mask of respirator is contaminated, not touching the front and disposing the mask properly to prevent the transmission of precaution. Then perform hand hygiene immediately after the removing the PPE. Again, I'm Shella Silvestre. Thank you.